Ever wonder how certain medications might affect your glaucoma? Let's take a moment to grasp the intriguing world of glaucoma and its connection to various medications. Glaucoma, a condition that affects millions worldwide, is more than just a term we come across in health magazines or doctors' offices. It's a serious, often lifelong eye condition that can result in vision loss if not properly managed. Imagine a persistent pressure building up within your eye, slowly but surely damaging the optic nerve, the very cable transmitting visual information from your eye to your brain. That's glaucoma for you. But here's the kicker. Glaucoma often sneaks up on people, with no warning signs or symptoms until significant vision loss has occurred. That's why it's often referred to as the silent thief of sight. Now, managing glaucoma is not a one-size-fits-all scenario. It involves a tailored treatment plan, typically involving medications designed to lower eye pressure. However, the plot thickens when we consider that certain medications for other conditions can potentially influence glaucoma. Yes, you heard it right. Some drugs, even those we might think of as harmless, can exacerbate glaucoma or interfere with its treatment. These medications can increase eye pressure, accelerate vision loss, or even counteract the effects of glaucoma medications. Understanding this interplay between glaucoma and other medications is crucial. It's like navigating a maze. You need to know the right path to take to ensure your safety and well-being. By being aware of these potential medication pitfalls, you can work alongside your healthcare provider to ensure your treatment plan is as effective and safe as possible. With this knowledge, we're better equipped to manage glaucoma and maintain the health of our precious eyes. So, are you ready to delve deeper into this topic, because we're about to uncover the specifics? Stay tuned as we dive into the specific medications you should avoid if you have glaucoma. First on the list, we have steroids. Steroids, while beneficial for a myriad of conditions, may not be the best friend of someone with glaucoma. Why, you may ask? Well, steroids are known to increase eye pressure, which is the last thing you'd want with glaucoma. According to various studies, prolonged use of steroids can potentially lead to a condition known as steroid-induced glaucoma. This is because steroids interfere with the eye's natural ability to regulate fluid pressure. Not convinced? Even prominent eye health experts caution against the use of steroids for glaucoma patients. They advocate for careful monitoring and alternative treatments whenever possible. Remember, managing glaucoma is all about controlling eye pressure. If a medication, like steroids, threatens to spike that pressure, it's a risk not worth taking. So, if you have glaucoma, it's best to steer clear of steroids. Next up, antidepressants. In the world of mental health, antidepressants play a crucial role. However, it's important to know that certain antidepressants can affect your eye pressure, potentially exacerbating glaucoma. You might be wondering, how does that happen? Well, some antidepressants can cause dilation of the pupils, which can lead to an increase in intraocular pressure. For someone with glaucoma, this could potentially worsen the condition. Examples of such antidepressants include selective serotonin reuptake inhibitors, like fluoxetine and sertraline, and tricyclic antidepressants such as amitriptyline. These medications are commonly prescribed for depression and anxiety disorders, but they can pose challenges for glaucoma patients. But don't let this information alarm you. It's not a hard and fast rule that these medications will worsen glaucoma. It's about individual reactions and how your body responds to these medications. Remember, if you have glaucoma, talk to your doctor before starting any new antidepressant. Third on our list, blood pressure medication. Such medications are essential for many, helping to regulate the body's circulatory system. However, they can sometimes have unintended effects on the eyes, specifically for those managing glaucoma. How so, you might ask? Well, while these medications are designed to lower blood pressure, they can also inadvertently lower eye pressure. While this might sound like a good thing, in the case of glaucoma, it can actually make things worse. You see, a balanced eye pressure is crucial. Too high, and it can damage the optic nerve, leading to glaucoma. But too low, and it can disrupt the eye's ability to properly nourish itself. This can lead to vision problems and potentially worsen existing glaucoma conditions. That's why it's important to discuss with your healthcare provider if you're on blood pressure medication and also managing glaucoma. So, if you're managing glaucoma, be cautious with certain blood pressure medications. Fourth, we have antihistamines. Now, these are commonly used to treat allergies, but did you know they can also affect eye pressure? That's right. Antihistamines can cause changes in your vision by dilating your pupils, which in turn can increase the pressure inside your eyes. This is particularly important for those who have narrow or closed-angle glaucoma, as these medications can exacerbate the condition, leading to acute glaucoma attacks. These attacks can cause a rapid rise in eye pressure, leading to severe eye pain, redness, blurred vision, and even permanent vision loss, if not treated immediately. Even for those with open-angle glaucoma, long-term use of antihistamines can still pose a risk. While the immediate effects might not be as dramatic, over time, they can contribute to an increase in eye pressure. So it's not just about avoiding antihistamines, but about being aware of their potential impact on your eyes. So be careful with antihistamines if you have glaucoma. Lastly, over-the-counter drugs. Over-the-counter or OTC drugs are medications you can buy without a prescription. They're generally safe and effective for most people, but for those with glaucoma, it's a different story. Among these OTC drugs are common cold and flu medications. Now you might ask, what's the connection between these and glaucoma? Well, many cold and flu medications contain decongestants, which are known to increase eye pressure, a major factor in glaucoma progression. When you're already dealing with a condition that causes increased eye pressure, adding more to it can potentially worsen the situation. It's also worth noting that some OTC pain relievers and sleep aids can have similar effects. It's not about panicking or avoiding these medications altogether, but about being aware and making informed decisions. In essence, it's crucial to consult with your doctor before taking any over-the-counter drug if you have glaucoma. Remember, managing glaucoma is a team effort between you and your healthcare provider. So always consult with your doctor before taking any over-the-counter drug if you have glaucoma. So, we've covered quite a bit today. Let's take a moment now to recap and bring it all together. First, we dove into the world of steroids. We learned that while they can be effective for a range of health conditions, they can increase eye pressure, a key risk factor for glaucoma. This is why it's crucial to monitor their use and inform your healthcare provider if you're taking them. Next, we explored the link between antidepressants and glaucoma. Antidepressants, particularly the older ones known as tricyclics, can cause pupil dilation, potentially worsening glaucoma. It's a delicate balance to strike, and your healthcare provider can guide you best. We then discussed blood pressure medications. While essential for managing hypertension, some of these drugs can reduce blood flow to the optic nerve, exacerbating glaucoma. It's a complex interplay and underlines the importance of holistic healthcare. Our fourth stop was the realm of antihistamines. We learned that these allergy fighters can cause dry eyes and blurred vision, both of which can make glaucoma more challenging to manage. Again, it's all about balance, and your healthcare provider can help you navigate these waters. Finally, we looked at over-the-counter drugs. These seemingly harmless medications, like those for colds and allergies, can have hidden effects on glaucoma. That's why it's so important to read labels and consult your healthcare provider before taking any new medication. In essence, while these medications have their benefits, they can potentially worsen glaucoma. But remember, this is not a cause for panic. It's a call for awareness and open communication with your healthcare provider. You're not alone in this journey. There's a whole community of healthcare professionals, researchers, and fellow glaucoma patients out there, ready to support you. Knowledge is power, and you've added a lot to your arsenal today. Remember, always consult with your healthcare provider before starting any new medication. Stay safe and take care of your eyes.